All right, so today we are going to go over chapter 16 in the pharmacology book, which we will be going over the treatment of disorders of the ear. In this chapter, we will be learning about the following objectives, which includes you learning about the terminology that's associated with the ear. At the end of this chapter, you should be able to describe some factors that influence the sense of balance. You should be able to become familiar with the disorders of the ear as well as the ear infections. You should be able to list and categorize medications that's used in the treatment of disorders of the ear as well as ear infections. You will be able to identify significant drug look-alike, sound-alike issues, and you should also be able to identify some warning labels and precautionary messages that's associated with medications that's used in the treatment of disorders of the ear as well as ear infections. So some of the key terms when it comes to the ear, you can always refer to your chapter terms. These can be found in both chapter 16 of pharmacology as well as chapter 26 in your pharmacy technician principles and practice book. Some of the key terms when it comes to the ear includes the auditory canal, which is a 1 inch segment of the tube that extends from the external ear to the middle ear. We'll also learn about the auricle, which is the outer protecting portion of the ear. We'll also learn about the cerumen, which is the medical term for earwax. In addition to the ear, you'll learn about the Eustachian tube, which is a structure in the middle ear that basically connects with the nasopharynx, which is the medical term for throat, and how the Eustachian tube equalizes pressure between the outside air as well as the middle air, and it also helps by draining the mucus. It's also important to understand that anytime you hear the word otic, OTIC, that represents pertaining to the ear. So we've learned ophthalmic pertains to the eye. You're now going to learn that otic pertains to the ear. So now that we've gone over a few of the terms in regards to the ear, we're next going to learn about some disorders that affects the hearing. So one of the disorders that affects the hearing is the otosclerosis. And so this happens by a sudden sensorineural hearing loss, which is abbreviated as SSHL. There's also an autoimmune hearing loss, which would come from possibly multiple sclerosis. So as we continue to learn about the disorders that also affect the ear, we'll also learn about a disorder called tinnitus. And so with tinnitus, it's a intermittent or continuous whistling, crackling, and squeaking, or it can also have ringing noise in the ears. Now, the tinnitus can be caused by a disease, presbycusis. It could also be caused by drug use, or it could be caused by noise. Now, a person that might have a disorder of tinnitus, it might be a sign of ototoxicity. So with a disorder such as tinnitus, it's treated by masking the noise under a noise generator or even stress management, and also avoiding alcohol or things that makes tinnitus worse. So there are some medications that can produce some symptoms relief if the tinnitus is severe. So now that we've learned about some of the disorders that can affect the hearing, we'll next learn about the sense of balance. So with the sense of balance, there is a sense organ for the balance or the equilibrium. So some of those senses of balance would be the vestibule, and that's where you have the utricle and the saccule, and then you have a function in the static equilibrium. You also have a sense of position of heard relative to gravity, and then acceleration and deceleration of the body. So when I say balance or equilibrium, you can try to think of like if you're driving in a car and let's say one side of the window, on one side of the window it's closed and then the other side is open, you're going to continue feeling, like air coming through your ear, but it's gonna be off balance because both of your ears are not being used the same. So if one part of the ear is not being used the same, there could be a sense of unbalance and the equilibrium would not be centered. So with the senses of balance, you have the semicircular canals of the larynx, and this is where the fluids shift when the body is in motion. And it also informs the body of the direction and the speed of a rotation. So with balance, it's determined with the input from the eye, the inner ear, as well as the sense receptors on the skin and the skeleton. So when we feel off balance, some of these things could also cause us to feel uneasy, because we don't feel centered. Even something as simple as hearing could affect that. So now that we've talked about the sense of balance, let's next learn about some of the disorders of the sense of motion and balance. So one of the disorders of sense and one of the examples of the disorders of sense of motion and balance would include vertigo. And vertigo is a balance disorder that's caused by a neural mismatch or a sensory conflict. So there are some symptoms that's associated with vertigo. Some of those symptoms include dizziness or spinning, nausea and vomiting, which is important to know. The medical abbreviation for nausea and vomiting is NNV. Some other symptoms include blurred vision, disorientation, as well as a feeling of falling. So head trauma, degeneration of otolith organs, um, or even inflammation of the vestibular nerve, or bacterial infection of a brain stem or cerebral pathology, um, or even motion sickness. All of those things could also produce vertigo. So continuing to learn about the disorders of sense of balance and of motion, you have the benign paroxysmal positional vertigo. So this is something that might result of trauma to the ear and an infection or even a degeneration of otolith organs. There's also a shifting of otoliths that produces vertigo, nausea, and nystagmus. And then you have the Meniere's disease, and this is considered a chronic inner ear disease. It has a intermittent buildup of fluid that's in the ear. And then in case of tinnitus, if it progresses, there is nerve deafness and vertigo. And then another disorder of the sense of balance and motion is motion sickness. So there are even some over-the-counter items that can assist with motion sickness, and then there are some medications that's prescribed that can assist with vertigo. So now that we've learned about some of the disorders of the sense of balance and motion, we're next going to learn about some treatment of vertigo and the Meniere's disease. So some of the treatment that can assist in these disorders would include physical therapy, some lifestyle changes, antihistamines. Antihistamines can be both either over the counter or possibly something can be prescribed. You have other medications, such as anticholinergic actions that can moderate the symptoms of motion sickness. And then another treatment that can help would be to reduce the eye activity that's responsible for the symptoms of vertigo. So even if people are traveling and they might sense vertigo, there could be possibly some physical therapy that could assist in the way that they're feeling so that they don't feel as bad. Now, with antihistamines, those should be used with caution when a patient has prostate disease, or if they have asthma, or if a person is lactating. That's a mother who's given birth to a baby and they are nursing. Now, there are some adverse effects of an antihistamine, and these include sedation, dry mouth, urinary retention, blurred vision, and also local irritation, especially if a antihistamine patch is used. So now that we've gone over some of the treatments for vertigo and Meniere's disease, we're next going to learn about some treatment of the disorders of the ear. So one of the disorders of the ear is called Auralgia, which another name for that is called Otalgia. You should know anytime you see algia, that could also represent pain. So Auralgia is the medical term for painful ear. So there are a few ways how this particular disorder could be caused. That could be caused by otitis externa, otitis media, swimmer's ear, TMJ, which is a temporomandibular joint disorder. That's another name for a lockjaw, and then also an abscess teeth. So there are some otic drops. Remember, otic representing eardrops. So eardrops can produce stinging, which may be minimized by administering suspensions rather than solutions. So when you hear the term suspensions or solutions, that represents a liquid. So when medications are prescribed, there are different medications that could assist the patient in some of their disorders. And when a prescription is prescribed for either a eardrop or an eye drop, those come available in either a suspension or a solution. And the difference between the two liquids, a solution is more of a clear substance, whereas a suspension might be cloudy. Um, and so we'll get into more of the suspensions and the solutions as we continue, but just wanted to go over the examples of those two. So as we learned about the treatment in some of the things that causes the ear pain, let's get into a little bit more in depth of what can actually treat the ear pain. So some examples of what may treat the ear pain could be topical anesthetics, local anesthetics, oral analgesics, or corticosteroids. So a topical analgesic is going to be something that could be like a lotion or a cream or an ointment or a gel. A local anesthetic is going to be something where the medicine would go locally on that particular area. And then an oral analgesic is something that could be taken by mouth. And then you have the corticosteroids. Now, with the local anesthetics, that's going to help by numbing or anesthese the ear canal as well as the tympanic membrane. And that's going to help by reducing the pain and the irritation. And an example of the corticosteroid, such as hydrocortisone, is going to be combined with otic agents that's going to help by reducing the inflammation as well as the pain. So let's continue learning about the sound-alike, look-alike medications. So when it comes to medications that's prescribed, there are some medications that look similar. So you always want to pay very close attention to the medications that looks similar to another medication so that you make sure you're choosing the right one. So the acronym for sound-alike, look-alike drug is the acronym SALAD. That's SALAD. And so an example of a ear medication that can look familiar to another is the diphenhydramine and the diphenhydrinate. Two different medications, two different uses, but they are often confused. So it's very important to pay very close attention to the medications that's being selected. Now, with diphenhydramine, that is the generic of Benadryl. Now, that particular medication uh, is available also over the counter. So as we continue learning about the ear disorders, we're also going to learn about some warning labels that we should pay attention to and look out for. So for antihistamines, if someone is taking an antihistamine, some of the warning labels that would be put on the medication bottles would include that it may cause drowsiness, it might impair someone's ability to drive. The person who's taking the antihistamine should avoid alcohol. They should also maintain adequate fluid intake. They should observe good oral hygiene, and they should also rotate the site of a patch application in case they're taking an antihistamine patch, which is also available. So when we say warning labels, as a pharmacy technician, when you are filling prescriptions, there is a label that's going to print out. I'm using a community pharmacy setting as an example, but there is always going to be a label that prints out after a medication has been typed. And once the medication label has been printed, uh, based on the medication, it'll always have some auxiliary labels. An auxiliary label is another thing of saying caution labels or warning labels. These are things that the patient should be aware of. Now, of course, when a patient comes to the pharmacy, they can speak to the pharmacist about any type of side effects or things that they should look out for. But the warning labels is going to be an additional documentation that the patient can look at so that they always remember. So some of the warning labels could even be on the medication bottle. So that way, anytime they grab that medication bottle, they're going to see that warning label. So generally, when a warning label is selected, we choose usually about one or two. You always choose the most important ones. So with this one, it's important that we would use an example, possibly that it may impair someone's ability to drive, and then even possibly choosing the avoid alcohol label as an example. So these are just some of the warning labels that would be used for an antihistamine. So now that we've talked about some of the warning labels and some of the sound-alike, look-alike drugs when it comes to medications that's for the ears, we're going to continue learning about some of the other ear disorders. So one, or should I say two, of the disorders that may happen may be water-clogged ears or swimmer's ears. So water-clogged ears is fluids that accumulate in the ear after swimming or showering. Water-clogged ears can also cause someone to experience an earache. And then you have a such disorder called swimmer's ear. And swimmer's ear is where there's an inflammation as well as an infection to the external ear. It also has a prolonged exposure to water, and it can also cause damage to the lining of the ear canal. A person experiencing swimmer's ear would experience acute pain, which means they would experience pain for a short period of time, but they would also experience itching and also a foul smelling discharge. Now, there are some non-prescription drying agents that are safe and effective for treatment of water-clogged ears. So if a patient comes to the pharmacy and they express what their symptoms are to the pharmacist might counsel them and suggest that they have a certain recommended brand of a non-prescription drug over the counter that could help with water-clogged ears. Now, when it comes to other solutions, there is something called Aerosdry. Aerosdry and other examples of like a mild acidic solution of vinegar or boric acid is going to help by drying the excess water, and it can also soothe the eardrum. Now, there are some agents that contains alcohol that might sting if the ears are inflamed. So there is a difference between water-clogged ears as well as swimmer's ears. Now, if a person is experiencing an earache, there are some other things that might be associated with that. They might even have a headache later on down the line because of the pain. And then it's just going to be very hard for them to kind of function, because if their ears are clogged or inflamed, or if there is an infection, it's going to really be irritating to them. So there are some medications that can help with these types of disorders. So now that I've talked about what the meaning of a water-clogged ear and swimmer's ear is. We're next going to learn about a cerumen impaction. So it's important to understand that cerumen is an example of earwax. And so with earwax, it helps by reducing the risk of bacterial infections in the ear. Earwax also repels the water, and it also helps to keep the ear dry. It also provides a barrier to the entry of airborne substances. So this means us having earwax in our ear is going to help by having a barrier to protect against dust or even insects that might go into the ear canal. Now, with the earwax, it's going to help by lubricating the skin of the external ear canal. But it's important to understand, even though Q-tips, I always like sharing this information with people, even though people see Q-tips and some people might use them to clean their ears, it's super important to know how to properly clean your ear, because when you use a Q-tip, you can actually end up pushing the earwax inside of your ear deeper, and that can also cause some problems because we have three parts to our ear, which is the external ear, the middle, and also the interior. So it's very important that when cleaning the ears, you don't want to push anything inside because they can go further into the ear canal. So as we continue learning about earwax, we'll learn about the cerumenolytics. And so you have two different types of things that can help clean it. And so one of them is going to be emollients. And the emollients is used to soften the wax, therefore enabling it to slide out of the ear. And then you also have carbamide peroxide, and this works by breaking up the earwax and in bubbles away the debris. And so to properly remove the earwax, a person would apply emollients or a peroxide-based agents, and they would use a bulb syringe that can gently irritate the ear with warm water to remove the earwax that's become dislodged. And so it's super important to pay attention if that's something that's going to be done, because remember, if you're cleaning your own ear, you can't see what you're doing. So you want to be careful when you're doing that, or if you're doing that for someone else. So now that we've talked about some of the disorders of the ear, let's next learn about some of the bacterial infections in the ear. So some of the bacterial infections would include the Otitis externa. This is also better known as swimmer's ear. So having this particular bacterial infection would cause inflammation of the external auditory canal. It also, the person who's experiencing the swimmer's ear would have pain, itchiness, and discharge. And so for treatment for something that's supposed to help clear up the bacterial infection, possibly topical or a systemic drug might be used. So topical is where something would be applied to the ear, or a systemic drug is where somebody might take something by mouth. So there are some risk factors, which include exposure to excessive moisture, high environmental temperature, and irritation that's caused by earwax removal. Also, an insertion of objects into the ear and a chronic dermatological disease. So, excuse me, it's always important to make sure that the risk factors are always taken into account. So now that we've talked about one of the bacterial infections of the ear, which is Otitis externa, we'll next learn about the causes of it. So some of the causes that might cause the Otitis externa would include having a bacterial or a fungal infection, having seborrheic dermatitis, having psoriasis, or having lupus erythematosus. And so the most common cause of otitis externa is actually having a bacterial infection. So as we learned about what causes it, let's next learn about what treats it. So I talked about two of the things that can treat it, which would be topical or systemic drugs. So with a topical anti-infective, that would be known as an antibiotic that's going to help treat it. There are different drug classes of medications. So think of think of when you go to a grocery store. I always try to use an analogy when I try to explain what a class is. So think of when you go to a grocery store and you want to pick up lettuce, or you want to pick up um, bok choy, or cabbage. That belongs to the vegetable family. So that's a class. And so with medications, even though something might be an antibiotic, there are different types of antibiotics. So that's why I use the example of vegetables. Vegetables is a class, but you have different types of vegetables. Same thing with medications. uh, the drug class might be an antibiotic, but you have different types of antibiotics. So in this case, something that's going to help treat the otitis externa would be aminoglycosides. That's known as the drug class. The medication that belongs to the drug class of aminoglycosides is gentamicin. Another medication class that might help would be the quinolones. And an example of a topical anti-infective is ofloxacin. I know these all seem like real different types of words to probably even pronounce, but I promise you, with practice and with time, you'll be saying them just like I am. Now, some other treatment of the otitis externa would include an anti-infective and a corticosteroid. So remember, the corticosteroid is going to help with inflammation and pain. So this would be like a combination drug. So an example of an anti-infective with a corticosteroid would be ciprofloxacin and dexamethasone. You would also have ciprofloxacin and hydrocortisone. And then you have the triple therapy, which is neomycin, polymyxin B, and hydrocortisone. And then there is another drug that could assist, which would be the acetic acid and the hydrocortisone. All of these that I just mentioned represent the generic names, but if you looked up the generic names, you would see what the brand name to the medications are. So now that I've talked about the treatment of the otitis externa, we'll next learn about another bacterial infection of the ear, which includes the otitis media. Now, the otitis media is where the inner ear, the middle ear, is going to be inflamed. And this would be happening by an accumulation of fluid in the middle ear that could possibly be due to a blocked Eustachian tube. And so inside of the middle ear, bacteria is collected in the fluid, and a person who experiences otitis media is going to be experiencing some pain, some pressure, and even a tearing of the eardrum. So when we are dealing with patients, we never really know all of what they're going through. But when they come to the pharmacy with a prescription, it's definitely important that we try to express empathy to them because they're going through a lot. So you might recall a time where you were in pain one time, or maybe a family member was in pain, and it's not easy. So you always have to keep in the forefront of your mind, our patients are our priority. So it's always important to make sure that we are trying our best to always help aid them, as well as assisting the pharmacist with those duties to prepare the prescription for the patient. So we learned about the otitis media and that it's where the middle ear is inflamed. Next, let's learn about some treatment of the otitis media. So some of the treatment is going to include antibiotics, and there are different there are different classes of the antibiotic. An example would be penicillins, macrolides, cephalosporins, or sulfonamides. Now, all of these, again, sounds very different and very unique, but these represent the classes of drugs. There are certain medications that have names. So an example of a penicillin might be amoxicillin, or penicillin itself. An example of a cephalosporin would be Keflex, better known as cephalexin. And then you have sulfonamides. These are considered sulfa drugs. So it's important to understand anytime you speak to a patient and they tell you that they're allergic to sulfa drugs, that means they would be allergic to any sulfonamide. So that's the class. And seeing that we learned about some of the treatment that's going to help with the middle ear inflammation infection. Next, we'll learn about some medications to pay very close attention to because they sound alike and they look alike. So some of those examples would be pediazole and pediapred, two different medications. So pay very close attention to which drug you're selecting. Other drugs that's very commonly mistaken would be the cefixamine, uh, cefurosin, cefotaxime, and cephalexin. I said that one earlier. Others that might look alike and sound alike would be amoxicillin, ampicillin, and augmentin. Now, it's very important to pay very close attention to the augmentin because augmentin's generic has two names to it. And its generic name of augmentin is amoxicillin clavulanic acid. So if you're pulling amoxicillin from the shelf in the pharmacy, make sure you're pulling the right one. And that's actually going to conclude the lecture portion for chapter 16 as we learned about treatment of the disorders of the ear.